when it came to seeing a question like that on a national exam, because the scope of practice, as they would say at the local hospitals, they know that they can't stick a needle in somebody's chest.
I started as an instructor at Midstate in 2007 in my present position as the Director of Clinical Education. But I worked with students through Midstate since 1995. And I went to UW Stout for a degree in Hotel and Restaurant Management, and I graduated from there in 1979. And I went overseas in the Peace Corps in the Philippines. For 2 years, I went in as an income generation volunteer, but then they needed health volunteers, so I kind of segued into health. And I was working in a rural area of the northern part of the Philippines from 82 to 84. And then I stayed for another 3 years. We came back in 88, and I had a hard time finding a job. And I went back to school, got my bachelor's first, then went back for my associate, which is kind of backwards. But so I graduated in 91 and started working at Marshfield Medical Center, or at that time it was St. Joseph's Hospital. We are a hands-on program, so they do their clinical competencies on patients, on people on life support. I mean, that's what they kind of work their way up to. We kind of start simple, but it's pretty much the duties and responsibilities of the job. We train people in 3 main areas. We train them in soft skills because that's what the employers want. So they're looking for people that are motivated, that are ethical, that are good communication, that can critically think. And so we have to kind of train them for that. Not only the soft skills, but it is then it's also the didactic. The didactic would be because they have to take a national exam. Unfortunately, it's a written exam, and they have to be able to understand. They have to be able to read and then choose the correct answer. But we also have the hands-on, because we are a very hands-on program. They are required to do 33 clinical competencies, and that's not just our program. The state of Wisconsin has 7 respiratory therapy schools, and we have a statewide curriculum that we all follow. And our program is set up, the first year is in class, and then after that in the summer they're in clinical. So basically a year in clinical, 2 days a week, 8 hours a day. Our students are learning from their patients. They're going to tell them things. They're learning from physicians. They're learning from other students. They're learning from the respiratory therapists that they're with, Jamie and I in our program, and then also our clinical instructors. We are pretty strict, I would say particular, because you can't really cut corners, and because you don't want that to happen in your healthcare.